Okay, so I just want to say thank you to everybody for joining us today for this, what I find to be one of the most important conversations that we're going to start to have. I'm hoping that this starts that language and this starts, the conversation on home health care. Everybody that knows me knows that I'm a big advocate for the home care worker, the home care profession. I'm a registered nurse, been a nurse 30 years, and the owner of the licensed home care company for about 4. So for me, home care is where my love is, and that's where my life is, and I care so much about what's going on right now that really I couldn't keep my mouth shut anymore. So I'm so grateful for Christine to listening to me for all these years and to creating a good team that we can talk about this, because this is something that has to be addressed. When you talk about essential workers, and me being a nurse, I know that I'm an essential worker, even in the capacity that I do right now, but we really have to start talking about the essential workers in the home, because no one's addressing the issues that we as an agency and the home care workers are facing right now. So when we're going to be talking about funding, we're going to talk about the fact that, any equipment or any supplies that my workers are having right now was purchased by me, going to find it by myself, going to figure out how I'm going to find it, share the information that I was able to find some things. And luckily we are a union agency, we're 1199. So thank God that they did give us some supplies as well. And we are so grateful for that. But there's so many other agencies that are not union that don't have the funds, the money to go out and buy and protect their workers to the level which they really do deserve. So I want to thank you, Christine Pellegrino, who I consider a friend of mine, and a former Assemblywoman and running for state Senate. So she will be one of our senators very soon, and I'm very proud. So Christine, I tell you this all the time. I'm so grateful for you to take a stand and to create this kind of platform to get our voices out there, because it really needs to be addressed. And so I'm going to, turn it over to you and really thank you for the opportunity of us coming together as a team.
Oh, thank you so much. And thank you to everybody that's joining us today. And we are recording this. So for anybody that is not able to join us live now or to be on this call, we will, send out this recording later and a press release afterwards. And I'm so proud to stand with Dana Arnone and her staff from Reliance Home Senior Services, Dr. Sheryl Pearl, Susan Brett, and her organization. She's the Chief Operating Officer at PeopleCare, a licensed home community-based organization that provides home care to over 3,000 members a day. Both organizations, members of 1199 SEIU, stand together in our fight to ensure that all essential staff have the funding and supplies that they need to stay safe and healthy while providing our communities the critical care that they deserve. We called this meeting together to call for and attention to the need for increased support from the federal government for home and community-based services, as they have become more vital than ever before. Rightly deemed essential workers by the New York State Department of Health, home health aides provide critical care for homebound patients and assist in reducing the spread of coronavirus by protecting society's most vulnerable members. We're here today to say that our federal government must do more to protect the healthcare workers who enter the homes of our elderly and perform essential services which keep them from entering our hospitals. Home healthcare workers reduce the likelihood of hospitalization and allow at-risk patients to receive the care that they need in their homes. Now more than ever, New York's hospitals are depending on home health aides to continue their care for the homebound, the immunocompromised, and discharged patients. These patients include those who have recovered from COVID-19. Therefore, we are calling for home healthcare workers to receive the resources from the federal government, which will allow agencies to attract and retain workers, which include PPE, to protect themselves and their patients from the dangerous spread of the virus every day, enhanced compensation, sick pay, transportation subsidy, and child care coverage. Additionally, home healthcare agencies have willingly shouldered the exorbitant and unexpected expense of PPE. We believe that it is critical for maintaining the plateau of cases in New York. We are asking for federal reimbursement for expenses for the associated costs of PPE so that our home healthcare providers and agencies can continue to provide the services to our homebound patients. As Governor Cuomo has emphasized time and time again at his COVID-19 press conferences, diminishing the cases of COVID-19 depends entirely on what we do as a community to support one another, fighting to make sure that our home health aides have the supplies and infrastructure that they need to keep their patients healthy and out of the emergency room is an essential part of keeping all New Yorkers healthy and safe. So I want to thank you all for being here, and I'm going to ask Dana Arnone, who is a registered nurse, if you have the founder of Reliance Home Care Senior Services, creator of the podcast, All Things Home Care. I'm so grateful for all the things that you're doing to promote and advocate for your industry and for your workers and for your senior members and care. Dana never shies away from educating others about the important role of home health aides and assumes and the things that they do every day in the front lines of their critical work. Their jobs are now, as I mentioned, deemed essential and have been, but many providers and aides don't have the support that they need from their community. Dana, if you have remarks, please. Thank you so much.
If I have remarks, that's funny. Well, Christine, listen, we talk about this every day, and I'm sure that people, if they follow me on social media or if they follow my podcast, the cable show, this has become something that I have advocated for such a long time. I don't think people really see the home health aide. They don't really know what they do. So they see people walking, or maybe they see people going to someone's home. But the reality is that with that worker in that home is really going to be the deciding factor a lot of the time of whether that person gets to stay home or if that person is going to end up in a nursing home or a hospital. So for me, keeping my workers safe is what's going to keep those patients safe. So me here at Reliance, we've gone out of our way to deliver equipment. I mean, we're far smaller than People Care. So I'm very happy to hear what Susan has to say with her struggles as well. And I know my place, and my place is very small, but we have a very big mouth. We act like we're big. But we go to all of our patients, or we try to anyway, go and deliver it one-on-one. I want to see for myself when I knock at that door, and all the social media, you'll see it. I'm literally knocking at the door, and those, I would say 99.9% of my staff has their mask on, their gloves on. They know, because they know the importance of keeping their patients safe. What happens a lot of the time is that families are scared. I don't blame them. They're looking to me to ensure the safety of their loved one, which is a huge responsibility for me. I don't take that lightly. I take that very seriously. So as I go throughout my day, I'm always thinking, how can we make this better? How can we help get the information out there? Because we as a whole, and I put myself along with my workers, we're the unseen frontline worker. And my daughter's a home health aide, and we discussed this before. So I had her on my show, and I'm asking her, I'm like, Julie, do you consider yourself an essential worker? And she goes, we are the front of the front line. That doesn't take away from the hospital doctors and nurses, because they're all my friends, right? We do business with them every day. But when you talk about an essential frontline worker, I don't think you get more frontline than being in front of the person and really helping them and engaging with them to keep them home. So that's a responsibility that we take extremely seriously here at Reliance. So I'm looking for help, because I don't think people hear me. They don't hear what the aides are saying. They don't really consider the aides as somebody that I don't even want to, what I want to say and what I should say, two different things. So I'll take that back. I think that people need to realize the importance of a home care worker. They're not babysitters. They're in there doing skill level care a lot of the time. Families are depending upon them, especially if the families right now themselves are not feeling well, or they're afraid of getting their loved one sick. They need the care of that aide to go into that home. So we need to keep them safe. And I don't understand for the life of me why they're not considered more important than anybody else, because those are really the ones that we're trying to keep home. And if they want to minimize their hospitalization rates, and if they want people to stay home, we got to look at the home care worker and how important they are into this whole scheme of things, into this, the hospital, the nursing home, and to the home care. So I'm grateful for the opportunity to be able to hear me and to hear what we have to say, and really look at the home care as more of a profession and something that we really need to start to recognize as the important part of the whole team. So I can say more if you want.
Thank you. No, you say it so beautifully and so eloquently every time. your voice and your fight is so essential. So I'm grateful for you not to be quiet about making sure that we get the resources that we desperately need to the people who desperately need them. And I'm grateful to be joined by Dr. Sheryl Pearl. And she is a family practitioner whose practice focuses on providing patients with home visits and community-based services. I am inviting her to speak about her experiences during this pandemic, as well as what she and home health aides face every day on the front lines during this pandemic. Thank you, Dr. Pearl.
Thank you for having me here. And I do want to say, Dana, I agree with you. Seniors are everyone's responsibility, whether they're in the home or in a nursing home or in the hospital. And the ones who are at home are often forgotten. And I think part of the problem is they're locked in this box right now. And the only people who can go in there are the aides. The families can't go in. I can't even set up intravenous treatments for these patients. As soon as I say they have a fever, the IV companies won't go in to even set up IVs. And they're locked in this box, and the families don't want them coming out, even if they're sick. They don't want them in the hospitals because if they're sick with COVID, they'll be completely isolated. If they are sick and stay in their homes, they have some access to the aid services that you're sending in. And if they don't have COVID and they're sick, they don't want them in the hospitals because they will then get COVID. And they're isolated and they're in this box. And if the aides don't go in, there is no one there to check on them, to feed them, to make their meals, to change their diapers, to take care of them. Their skin breaks down. They get delirious. They get more confused. It's just this spiral. And the truth is, the hospitals have been so flooded, they don't want more patients in the hospital. And for the patients that I've had to send to the hospital in the last month, I've had to fight with EMS when they come to pick them up because they don't want to take them to the hospitals because the hospitals are just flooded with patients and long waits. And, it's sad. I've signed so many death certificates in the last month for patients dying at home. I've never signed so many in such a short period. I stopped counting when this first started. Last week I did 14, which was much less than the week before.
That's horrible.
Yeah, one after another. And the sad thing is, it's causing I think it's going to be like a new form of grief because families can't be with their loved ones as they're dying. It's horrible. And you're not going to be able to mourn them after. We can't even have proper funerals and shivas and memorial services and things. And I think the healthcare society, we're going to suffer a new burden in a few months of grief and all these people and how to manage it. It's really tragic that people are so alone right now. Mm-hmm. And these workers need to go in. If they're not going in and they're not protected, first of all, I've seen some healthcare workers bring it into the homes because they were not wearing proper protective equipment. And if they're not going in, who's going to check on these people?
Right. So you're raising.
And I want to mention one other thing. Yeah. The other thing is, if seniors are everyone's responsibility, the government should be providing the proper protective equipment to physicians who go in to service them and to the companies like you guys that are providing the aids. They're providing protective equipment to nursing homes and hospitals now. Why aren't the seniors at home counted as part of a population that deserves that equipment?
That's the question, Dr. Pearl, right there. You just asked the question.
People through all of Long Island and Queens, right. And I'm supplying the equipment now, but what happens to my providers and myself when right. I can't access those N95 masks anymore?
Or you have a company like Susan that has thousands of workers. Right. How do you supply thousands of workers the equipment?
The government has to step in because otherwise these people will flood the emergency room. They're all going to get sick. And they don't want them there.
And you're bringing up the exact...
I cannot get the ambulance people to come and pick them up and even take them. I'm getting in fights with them.
Thank you, Dr. Pearl. So you're bringing up the exact point and a perfect point to invite Susan Brett
Yes.
to share her experiences. Susan Brett is the Chief Operating Officer of People Care, a licensed home and community-based organization that provides home care to over 3,000 Long Islanders every day. Larger agencies are facing unique challenges during this pandemic. We're so grateful for you and your colleagues who are able to join us here today and to describe what it is that we need from our federal government to help us in this critical time.
Thank you. And thank you so much, Christine. We're so happy and grateful to have you to champion the home and community-based services that are so vital right now, and especially during COVID-19. So just to be clear, People Care provides home care services to 3,000 clients a day, but throughout the boroughs of New York, as well as Long Island and Westchester. And I have to say, in this time of COVID, the aides, the home care workers have put themselves, their families, and their clients' needs first. But we are so concerned about their safety. We're sending them out in the homes without consistent access to PPE and the vital PPE that they need, the right kinds of PPE. And we're trying to prevent, ultimately, patients going back into the hospitals. We're trying to maintain these patients safely at home. Can you hear me? Okay, great. We're trying to ensure that these patients are able to stay safely at home. But our government, the federal government, has not provided funding for PPE for home and community-based services, specifically home care. We keep hearing on the news, we hear the governor, who's been doing a phenomenal job championing the healthcare sector and really advocating on behalf of New Yorkers. What I think the public doesn't realize is that the funding that's been earmarked so far under the Federal CARES Act has been really funded for the Medicare sector of home care. And the majority of home care services that are being provided to the most frail and vulnerable and elderly are those with chronic care conditions that are often paid for by Medicaid. And so what's important to know is that there has not been funding that has been earmarked for PPE for our home care workers to care for the most vulnerable patients that are at home, that are most high risk for going back into the ER, going back into the hospital. So that's really what we're fighting for, to make sure that our home care workers are safe and to ensure the safety and well-being of those patients in order to, remain safely, in their homes.
Susan, you have said it so succinctly and beautifully and absolutely critically, raising this issue of awareness, and it is affecting us all. And I'm so grateful for your voice and for the work that you do, and for highlighting the essential role that the home care worker plays in this pandemic, and how desperately we need to make sure that we care for them all at this time. So I'm grateful for your help in this time of awareness that we're making this call. So and I think that we're joined by a home care worker. Is that true? Who asked to remain anonymous, and I certainly understand why that is, and I just want to get clarification that that's the case, because I'm going to ask that person to join us for some comments about what an average pandemic day looks like on the front lines from the home in this experience. I'm so grateful that this person is here to contribute their voice to this urgent issue. And if we could unmute that person's, and thank you so much.
Hi, thank you for having me on. Can you hear me?
Yes.
Okay. So an average day for me is I get up in the morning. My client starts at 9 a.m. and it's a 10-hour day. I, leave my kids at home because right now, unfortunately, we don't have daycare, but I've been fortunate enough where I have my in-laws checking in on them and my husband. So my kids, they're home by themselves. They pretty much have to take care and look after each other and help each other with homework. I get on the bus, I go to work. Sometimes I have gloves, sometimes I don't. I'm fortunate enough to have masks. And that's what I wear to on the bus and to go into my patient's home. And as soon as I get there, I literally have to strip down because my patient's asking me to change my clothing because they're uncomfortable with me bringing in diseases and viruses from the outside, because though I'm trying to be cautious, I run into people every day. There's plenty of other aides at the bus stop. And we're all scared and we're all trying to just make our living and provide for our families. An average day for me is nerve-wracking, to say the least. But I go in, I support my patient, I help them with changing, bathing, I help feeding. My patient lives by herself, so that is good and bad. Good because there's no other exposures in the house other than me. But it's bad because when I'm not able to come in, I only work, it's a 10-hour day, so it's 4 days a week. The other days, she's not taking any care because she doesn't want another person in the house. She doesn't want multiple people coming into her house infecting her. So she's terrified that she's going to get sick and ends up in the hospital, especially with the news coverage. So ultimately, what we really need is more equipment. I'd love to have gloves available, masks available. I don't want to go home and have to, sanitize my mask. I want to be able to use a fresh one. So that's, it's a basic day.
Thank you so much for being willing to be here with us and to share your experiences and from such a critical perspective. We can't thank you enough. We have some questions that have been sent in and forwarded ahead, and are also seeing some questions in the chat. If there are any questions that are at this time that anybody wants to ask, questions from individuals or from the press, we're certainly willing and welcome to devote some time to questions.
Christine, can I say something?
Yeah.
Okay. So when you're listening to that home health aide talk, that's a normal day for most of our home care workers. But what the other thing that we're not discussing here, when you're talking about home care and services in the home, when they stop schools and when they don't have a lot of them relied upon the schooling for their childcare. I myself, I don't know about Susan, I don't know the demographics that they deal with, but most of our patients are in Nassau County. No one's addressing the fact that most home health aides for me are women with young children. They are not the sole providers in their household, so their income is secondary to the husband. So if they have to choose who's working today, it's the husband and not the home care worker. So now you're looking at inconsistent care of an elderly, homebound, frail person because their aide now has no child care. They have no wage, they're minimum wage workers. They can't afford babysitters. So the child care issue for Nassau County, I know they're trying to fix the issues in the boroughs, but me for Nassau, it's a huge issue. So you're talking about not only, the child care, the aides don't have the care for their kids, but you're talking about, for me as a registered nurse, I look at inconsistent care. I look at, they don't want different people coming into their homes because they're afraid of the viruses, and I don't blame them. So those are going to lead you to hospitalizations as well, because no one's saying, did you take your medicine? Did you eat today? Did you drink today? So those are the things that, as simple as it sounds, oh, it's just childcare. No, it's not just childcare. It is a huge issue for me as an owner of a business to where my aides can't work. So that's something else that they need to talk about, because it's a big problem. And more importantly, it's about inconsistent care for the patient. Right. And the fact that the
trickle down, which is why we have sort of echoed the demand for coverage, reimbursement for that care, because it's so critical that we have reimbursement for childcare so that home health aides are able to prioritize, and not be restricted, by the demands of not being able to access childcare. We have some questions. We're just accessing the questions that have come in by email, and just trying to pull them up. Just give 1 second. Some really good questions. So it looks like Dr. Pearl, one question. This might be for you. I hear a lot on the news in regards to the hospital and nursing home death toll rise. My mother is unfortunately homebound and receiving home health aid services through Medicaid. My question is, who's monitoring the death rate of the homebound elderly and that are not able to leave? Who is helping the agencies monitoring the safety? So basically, is there monitoring of that data, and can you speak to the statistics, even if it's anecdotally? You're muted. You're muted. We have to unmute. Hold on.
Okay, thank you. So anytime a patient or an individual passes away at home, the police are called unless that patient is on hospice. If when they're on hospice, the medical examiner does not get involved in the cause of death. So if you're not on hospice, the medical examiner gets called by the police, and then the police reach out to the ME. The ME reaches out to the physician and will say, oh, Dr. Pearl, your patient was found unresponsive today at home, or they were found on the floor, or whatever the story is. And I'll tell the ME exactly what I think is going on. But lately we're getting reports, well, there was a fever and they were short of breath and they didn't call anyone, or they got fever and short of breath. It happened within minutes. And the problem with this coronavirus is people are deteriorating so rapidly that even in the hospitals, you go to intubate them and they're being pronounced within minutes. The cardiac arrests are not like you have time. It's so rapid.
Right.
So people are dying really rapidly at home now. And the ME will say, this is the story, this is what I heard, or it has nothing to do with COVID. This was just someone who fell, broke their hip, and refused to go to the hospital because they were afraid they would get COVID if they went to the hospital. And it has happened to my patients. They've gotten COVID in the hospital from hip fractures, and then they've died.
So is there any like reporting? I think the question really was,
right.
Is there any?
I report it as a probable COVID if the medical examiner agrees to it. It goes down on the death certificate, and then I don't know where that data gets collected afterwards or how it's tracked.
Susan, do you want to?
Yeah, I could respond to it. Yeah, that's a great question. I want to emphasize how much the home and community-based organizations like the home care industry is doing to really send information and data back to the New York State Department of Health.
Right.
First of all, just to talk about an agency of our size, when we talk about monitoring patient care and in terms of screening for certain triggers, so to speak, shortness of breath, cough, fever, we've had to use an app. So we've actually unfunded, our agency has partnered to put an app on our home health aides that are in the home on their smartphones. So every single day, we are screening the aides, asking certain questions that are pertinent to COVID-19 for the aides themselves. We're also asking it on behalf of their patients. So that if an aide, our goal is to capture real-time data for prevention, so that if, for example, the aide is saying that today their homebound patient is experiencing sudden shortness of breath or fever, that information, the aide is responding on the app. Let's say they say, yes, my patient is experiencing shortness of breath. That information is going to a real-time dashboard that is monitored by clinicians and by nurses, so that our nurses can respond right away and be able to reach out to that patient and have them call the doctor, like Dr. Pearl, to take steps to address what's going on. We also are monitoring. So through that app, we're able to monitor signs and symptoms, people under investigation, PUIs, and we're also able to monitor as an agency any of our patients that unfortunately have passed away from COVID-19. We are tracking that information, and we work with the Home Care Association of New York. We work with the unions. We work with the Home Care Providers Association, and we're sending that information to the Department of Health through those associations. So that data is being captured. Unfortunately, with all that we're doing that's not funded, with all of that information we're sending on behalf of our patients, we're still not getting the PPE and the adequate resources to support all of this. But so yes, the answer to the caller is we are monitoring this information that's going back to the Department of Health.
So Susan, do you have a recommendation that you might be willing to provide in terms of making that information more visible to the public?
I think the challenge for community-based providers and smaller ones, we're one of the larger agencies, is that home care agencies often don't get recognized for the jobs that we do and the investment in care that we make. We're not properly funded. So I think there's many agencies out there, like People Care, that are trying their best to do the best job that they can, but don't have the infrastructure or the funding to pay for innovations like telehealth or apps for their aides. And so it makes it very difficult. And it's very hard because so many of us have furloughed or staggered our staff that we don't have the manpower to do everything that we wish we could be doing. So, I mean, I would say that if agencies are, I would say that our biggest message is to push for funding so that we're all able to collect the data consistently and send that to the state and let them know how relevant, the kinds of jobs that we're doing out there. And probably how few deaths, I hate to say it so bluntly, but because of the jobs we're doing, we are keeping patients safe and healthy at home and probably preventing so many deaths that would otherwise occur.
Such a complex issue, and I appreciate your experience and your voice in trying to tie it all together. Another question that came in: are home healthcare workers alerted that they are being sent to a patient if they are tested positive? Does that mechanism exist? And I don't know, Dana, if you want to field that question. You're on mute. Sorry, we're unmuting you.
Are you muting me for a reason, Christine? So we do tell our aides, I have to. We give them more precautions when they're going into some of this testing positive. The issue that we're seeing right now more is that our patients that tested positive went to the hospital, now they're coming home. So they want their caretakers back. They want the same aides back. The aides sometimes don't want to go back. Sometimes they're afraid to go back. We're talking to them about quarantine, and that's a whole other thing, because if an aide goes to a job and the patient tested positive, the aides are on quarantine now. So it's a mess. So to be very honest, we do tell them. I feel they should know, because we're not in the home. One of the big problems too with home care is that we're not there. So you have a 99-year-old person alone with a home care worker, the family's wherever, and I can't see them, which is a big problem for me, being a control freak. So I can't see what they're doing. So we try to give them all the tools, knowledge that they can in order to maintain their safety and the safety of the patient. But we are really now seeing people coming back from the hospital. Thank God, that they're coming back. But they're coming back positive with COVID, and the aides are very nervous.
Right.
Scared.
Understandably so.
And they're not so scared sometimes for themselves. It's because they have children, and they always say it's about their children, that they don't want to bring it home to their family. So, we do try to, it's a problem. It's
right. Which is why we're fighting for the funding.
Especially if I have to say something, I am not People Care. I'm tiny. And all the money that we made, Steve's probably on this call right now too, watching, went to buying equipment. And for me, if I spend 30,000, I shouldn't say that because he's on the call right now, but if I spend $30,000, right? But in order to make them safe, and the equipment's here,
Right.
and we're delivering it, but I don't get them. We don't have $30,000 to spend, but I did, and we had to, because I just, you can't put someone in someone's home and not properly protect them. So, and he's texting me right now, so he's probably going to yell at me.
But home care providers in general, I hate to say this, but we run on such thin margins. None of us we don't do this to get rich. We do this because we yearn to care for patients and keep them in homes and have a heart. And although we're large, Dana, I have to tell you that we're in the same boat.
Yeah.
We have had to, we've been very fortunate. Some organizations have been generous in making donations. 1199 has made donations, and New York City has made some donations to us, which we're grateful for, but in no way sufficient for all of our home care workers. So we've also had to do that. It's all kind of hands on deck, and we just went out there and purchased what we could for our home care workers.
But the point that I was trying to make is with an agency, I think my size agency is probably more common than you, right? So the smaller guy, they don't have $30,000 to protect their workers. So it's not even about, the monies that we're all spending. That other agency, I guarantee you, isn't spending that kind of money on the equipment. They might give one mask and a couple pairs of gloves and say, make do. And that shouldn't be. It's not fair.
So there are 2 points that I just want to make in closing, is that one is that we have the ability through the federal government's stimulus, the fact that they can pass a stimulus bill, and they have been passing stimulus bills that allow for the carve-outs and the direct relief, and in terms of the calls that we're making for funding in this way. So these expenses are real. They are not necessarily budgeted for by our providers. They are essential workers that need to be protected, and they are for our most vulnerable individuals in our society. And we should be prioritizing them as we do our children, as we do any member of our society, and we should get them the attention that they critically need. These mechanisms exist. We have a Defense Production Act that we can employ that would get the supplies that we need, and we should be making sure that we use all the tools in our toolbox. And these things would help us economically. They could keep our small businesses and our bigger businesses afloat, which is what we want to see. We don't want to see a recession or a crash. We want to see good businesses survive using good practices, and our home health care workers who are doing essential work stay working, and our elderly stay healthy and alive. And I can't thank you all enough for the work that you're doing, for putting yourselves into this fight every day. These are people who are critical to all of us. These are our loved ones. These are our parents. These are our grandparents, and we want to see them safe in their homes. This is where they want to be. They want to be in their homes. They don't want to necessarily be in the hospital. And for as long as they want to be not in a nursing home, this is a wonderful way that we can offer care that they desperately need and absolutely deserve. So I want to thank you for the work that you're doing in providing that service to them, and honor your service to, and especially during this time. Anything that I can do to shed light and make this a conversation that we could and should be having with more individuals every day. We should be doing it and getting the attention of important legislators who should be making this their priority as well. If there are any other questions that are out there, this would be the last time, or we could have forwarded questions. Oh, looks like we got somebody coming on, like connected by phone. What, Galaxy Note? No?
Yeah, they just came on.
Oh,
but I
well,
don't see
somebody.
any questions. No one has asked any questions yet, other than the ones we have.
Okay. There's no other questions?
Unless if someone here has a question.
Okay. I'm just gonna give another last minute in case there's any other questions. If anybody wants to raise their hand or put a question in the chat, or there's no question. We're just checking on the side if there's any questions in the chat. No questions. Okay. Okay. And anybody who wants to reach out to me can certainly do that. My email is Christine for New York, Christine FORNEWYORK @gmail. And you can certainly reach out to me directly. And I want to thank you so much for being here with us today. We recorded this, and we'll be putting it out on Facebook after we conclude our call. Thank you so much, everybody.
Christine.
Thank you, Christine.